Really wonderful hello to you, Henrietta. It's so nice to see
Thank
you.
you. Thank
How are
you.
you,
It's lovely to be
how are
here.
you today?
I'm good. Yeah, really good. Busy day, but yeah, really good. Really, really good.
So, in your day job, you run a homeless shelter, right? Buses for
Yes,
homeless.
yes, I
Amazing.
do. I
You amazing
do.
lady.
I do.
So
I do.
what's happening now?
Well,
What's happening with that
unfortunately,
now?
due to COVID, we've
Yeah.
had to close for maybe a month, maybe a little bit longer. We still don't know yet. So
Okay.
that's a little bit disappointing from our front. Although I've got to say, we have got five of our guys into full-time work and also into their own accommodation, which is just amazing.
Wow.
Yeah, yeah, yeah,
Amazing.
yeah.
How
Yeah.
many guys do you have altogether?
So altogether through the program over the last year, because COVID obviously extended the time of period that we had everybody there, we had pretty much 12 people through the program.
Oh, okay.
Yeah, which was great. Some it wasn't for them.
Yeah.
And some people weren't just weren't right for us and didn't necessarily want to make the change and get off the streets. But
So it's a program. It's a program you take them through to like
yes,
get them
for
back to
three
work and
months.
get them in.
Yeah,
Wow. Okay. Very
holistically,
cool.
all holistic. So we basically make sure that, we look after the heart and head first of all and find out why they became potentially homeless. And then
Mm.
we guide them through their learning skills and what they're good at. And we, tell them, it's sort of not tell them, but we let them tell us. It's time. People need time.
Yeah.
And we're more of a holistic view than a kind of get you off the street, get you straight into work. It's
Yeah.
not about
You
that at all.
slowly work through
Yeah,
it.
sorry, well, and I've actually just seen the lovely Nikki from New York who's is on here, and she came to see us last year, and she's absolutely amazing. So yeah, really good, really good.
Amazing. Okay. So let's talk about you and let's talk about
Mm-hmm.
this transformation and how you're finally going to let me get my hands on your teeth.
Yay!
Which I've been trying to do since I first met you. So first of all, to everyone out there, hello, who's listening, just to make it clear, I don't just like accost people at parties, and
No, no.
I never accost anyone at a party. But usually, every party I go to, someone will talk to me about their teeth or their face, about something
Mm-hmm.
that they want to change. Like bring me over to the side and be like, oh, while you're here, what do you think? And I think that's probably how it happened with us.
Yeah, it
Um,
did, pretty much, pretty much. I always
yeah.
said I wanted to change it. You were like, yeah, okay, come and see me,
Yeah, let's do it. Yeah. So we had a really good chat about it, I think in like 2012. And then, obviously it was
Mm-hmm.
a lot of money and it was a really big treatment. And you were like, I really want to do it. And, but it wasn't the right time for you.
No, it wasn't then. I was in the midst of changing jobs. I had my own business at the time, and I was beginning to come out of that business.
Yeah.
So financially, it wasn't going to be the right time for me
It
to do it
wasn't
then.
right, and
No.
it's a big expense, and it's something that you have to. And then I remember seeing you a few years later and saying, "Oh, I really want to do this," just because I think we'd mocked it up and we'd seen the
Mm.
change it was going to create. You have this beautiful face, and you kind of have these messy teeth.
Mm-hmm.
It's okay to say that. Is it okay to say
Yeah.
that?
Yeah.
And
100% they
I just
are.
know what a change it's going to make to just perfect everything else that's going on there, to change those. And I remember that then I said to you, I was like, "Oh, I really like to at least just make a start, just like get a brace in there or something."
Mm-hmm.
And you said, I think at the time you said to me, "Oh, actually, I'm thinking I'm okay. I think it adds character for me to have,
Yes.
these teeth as they are."
Yeah.
And then I was like, yeah, and that was interesting for me as well, because I guess patients feel like that sometimes. When I do smile makeovers, they'll be like, don't make them too perfect. Like, sometimes they'll do veneers and they'll say, I remember doing a case, it was a couple of years ago, to be fair, and they made me put one veneer on wonky because they didn't
Oh,
want
wow.
straight teeth. They didn't want straight
Yeah.
teeth at the end of it.
Yeah. Yeah.
So talk to me about that, about how then maybe you thought that maybe you didn't want to improve your smile.
Yeah, I think I'd had a lot of people when I talked to people about potentially changing my teeth, they were like, but Hen, the whole thing about you is, they maybe are a little bit wonky and your two front
Mm,
teeth here are slightly bigger.
mm,
And I suppose it was as I got older, I got a bit more self-conscious about it. And I
mm,
didn't like them. They were stained as well.
mm.
And I've got two very prominent eye teeth. And in a lot of pictures, I never smile. I never
Yeah.
ever smile.
It was hard to when we were looking for a picture to make the poster for this live, and yeah, like it had, because all my pictures I'm smiling, and then
Yeah,
every picture you're kind of like, I don't know what it's called,
pout.
smizing. I don't know what that is. Yeah,
Yeah,
yeah. There's a pose,
there's
and
always a
yeah,
pose and a pout.
I,
Yeah, I'm always known for that.
Yeah, I'm excited about, and people do that because you hide things that you don't think are your very best,
Yeah.
and so yeah. So I guess I'm excited about going through this transformation with you, and then I'm excited about at the end like how your Instagram's going to change, and
Yeah,
suddenly
it's
there'll be
going to
lots of
totally
memes,
change. Yeah.
because then you'll be showing off your best, one of your
There
best
will be
qualities. Because
smiles.
it's
There will
gonna
be
look
smiles.
so stunning. So yeah, that's
Yeah, I can't
hello, thanks
wait.
for joining, guys. So yeah, so I guess yeah, we start. I guess earlier this year you said to me it's time and let's do something. And then obviously I run my course now, and so it was perfect because I could use you as a delegate on my course, and then it was really affordable as well, because
Which
obviously
is
yeah,
great.
working at this homeless shelter, you're not about like making big bucks. You're about you've dedicated your life to doing something really good for the world, and so it's so nice to make this treatment yeah
Mm.
affordable and ready. So I think we kind of decided earlier this year that we'd use you for the course.
Yeah.
And in the meantime, I guess you were going through personal things. So if it's okay for me to say, you start going through menopause.
Yeah, I started going
Yeah,
through menopause. I'm proud to own it as
yeah,
basically
yeah, yeah. And you should be.
you
Like, yeah,
know,
we're women.
you,
It happens.
yeah,
Yeah.
we're women, and I'm going into the second part of my life. That's the way I see it now. I'm going
Mm,
into got over all that stuff in my sort of 20s and 30s, and now I'm kind of going into menopause. Yes, I was young.
mm,
I was 46 when I started going through it, and I'm just turned 47. So I was
mm,
very quite young to start
mm,
going through it. But it also massively affects your emotion side of things as
mm,
well. That's quite a big, big thing.
mm.
So for me, it was affecting my self-confidence, and it was affecting how I felt. Obviously, I didn't really know what was going on.
No.
And then I decided medically I had to do it naturally. So I couldn't rely on HRT or anything else like that. So I've had to do the whole
Mm.
thing naturally, which has been interesting.
Oh, someone's giving you
Um,
hearts for that. Yeah, for going through that.
oh,
Yeah,
thank you.
yeah.
And with thanks to the amazing, Michelle, she has been incredible and helped me with my nutrition and my supplements, which have just been a
Mm.
game changer for me.
Yeah.
So I really thought, okay, now's the time to take the step and to,
So
get my
just to let,
self-confidence
let,
back.
let everyone know, Michelle's nutritionist. Henrietta's been seeing
Yes.
her, and Henrietta looks great. And then I was like, and she was like, I was like, what's going on? And, well, apart from what I'm doing for you,
Yeah.
and she was like, yeah, I'm seeing this nutritionist. So now I'm seeing the same nutritionist. I've just started with her, so I'm excited about learning more about eating for our bodies and the best way to be fueling ourselves. Like I'm seeing it as biohacking and making myself super efficient and effective. And
Yes,
you did
your
it. You
brain
used her to help you get through menopause without
to help me get
medication.
through menopause because brain fog is a massive part of it, which I didn't
Brain fog.
realize.
Yeah.
So
Yeah.
forgetting things, I mean, putting things in stupid places, like
Yeah.
really stupid places,
Yeah.
and just not understanding what was going on. And
Yeah.
then Michelle was just literally like, okay, this is what we do. Let's focus on your gut health. And then that means that, and that means that. And then, yes, when I came to see you for one of my
Mm,
appointments, you were like, what are you
mm.
doing? Something's
Yeah.
different. What are you doing?
Yeah.
I was like, oh, I'm doing this. But
Yeah.
again, it's about, women talking about their situation, what they're going through is always really good.
Yeah, no, that's great. So then, yeah, so you started with your menopause, and I think you started to see the difference in your skin, and
Yes.
you didn't feel. Did you feel what was happening?
No, because as we did in March, just as we went into lockdown last year, I came to
Mm.
you about the skin side of stuff, and
Yeah,
obviously, which was amazing. You put me on a bargee
yeah,
initially,
yeah,
and that totally changed my skin. And
yeah.
within
Body's
a couple of
amazing.
months, people were like, "What's going on?" And then
Yeah,
obviously, your amazing skincare brand
the
came
Mind
out, and
Body
this is
launched in July.
in
Yes,
July.
and I was like, okay, time to remember.
Yeah,
Been creating
exactly.
something in the background.
Yeah, which I've done and obviously rave about to a lot of people. And
Yeah,
not just because I know you, but because it genuinely works. I
yeah,
think that's the
yeah.
biggest thing.
It's
You know,
medical grade, ingredient based
yes.
skincare products that make a difference. It doesn't just make you feel nice, it's actually like doing
No,
something for your skin and
it
making your
makes a
skin better
difference.
every
And
day.
when you can
Yeah,
see it, when you
yeah,
can actually see what it's doing,
yeah,
that's the biggest bonus, more than
yeah,
anything else. You can actually see what it's doing. So
yeah.
that really helps too. And I think, you know, people need to, skincare is really important, especially as you get older
Yeah.
and you get into your second part of life, you know,
Yeah.
it's
Yeah.
really important.
Yeah, I started noticing myself age from like 35, and that's because, yeah, all your cells slow down, so you're not producing the same. Hello, thank you guys. Hi, Bubbles.
Yeah.
So you're not producing the same, yeah, collagen, hyaluronic acid, elastin, all those beautiful things that you
Yeah.
produce to make this beautiful, youthful skin. And so then
Mm,
you need a little bit of help. You need to stimulate your cells,
absolutely.
and that's what medical grade skincare does for you. And it's not what counted products do for you. So counted
No.
products, you still have to put makeup over them and think, oh, I don't need to, whereas
Yeah.
medical
Yeah.
grade really starts
So,
stimulating. And I felt like that was another big difference in you. So, the Abaji, and then with my skincare, and your skin was looking amazing. It tightened up. It had a really nice glow to it. Also, your nutrition was all just changed over, wasn't it, to
yeah.
this beautiful nutrition plan you've been put on. And we started planning for your veneers.
I
um,
know. I
and so,
know.
all along, was really keen for you to have a brace before your veneers, because obviously, if you do a small makeover without having a brace first, if your teeth aren't straight, then I
Mm,
have to cut your teeth, and I don't want to
mm,
cut your teeth. I just want to place beautiful veneers on already straight teeth, so that there's no risk associated with this.
yeah.
Hi guys, and you weren't keen on that. So why weren't you? Why did you not want me to let you? Oh, thanks, guys. I don't know.
Hi.
Is it someone talking to you? Because they're not talking to me about my hair. They're
Yeah,
talking
no.
about you. I was like,
Thanks,
really? My hair
Joy.
looks really terrible.
Oh, bless her. Bless.
You
That's
look amazing,
lovely.
Henrietta.
I know. Thank you.
So yeah, you
Um,
didn't want the brace. So
no, I didn't want the brace, and I was being stubborn about it because I am
yes,
very stubborn. A lot of people that know me really, really well know that I'm not the user, I'm not stubborn. But I think also I'd had a bit of a medical issue.
yeah,
So in October, as you know, I had a problem with my wisdom teeth, and I ended up getting two big abscesses.
yeah.
Put me on to metronidazole, and unfortunately, I had a massive allergic reaction. So I had a full-blown seizure at work, which was terrifying.
Yeah, just unheard
And
of. It's
yeah,
it was such a thing. We're like, whoa, wow, yeah. So you had allergy to metronidazole.
yeah, metronidazole. So I had an allergy to that. And I think, you know, you and I really talked about it, and it was, you know, I've always had a phobia about dentists, and
Yeah,
it was the way that you said to me, look, Hen,
yeah,
we can cut your teeth, but I'm worried that it's going to cause problems,
yeah.
you know, and I was like, okay, do the
No more
brace then.
problems. We're not doing problems.
No, we don't need any more problems. We've had enough of
Yeah,
those.
yeah,
So I basically decided, you know what, let's do it. You
yeah.
know, let's do this brace. And to be honest, and you know, I'm going to say it. You were 100% right to
Yeah.
make me do that brace.
Thank you.
100% right.
Yeah, yeah.
Yeah,
I know
I
it's a
don't
bit
want any more
annoying.
problems. You know,
Yeah, it's
that's
it's
the
an
biggest
extra
thing.
expense. It's extra time. It's not comfortable. It's just something that no one ever wants to do.
Yeah.
But in the long run, it's so the right thing to do,
It
to
is,
have the best
yeah,
perks.
it is
So
massively. I mean, already things are beginning to shift. So, you know,
later.
it's great
Yeah,
seeing that,
it's
you
really
know.
quick. The inman line.
Yeah.
So we had an option of a few different braces, but we were time limited. So we were
Mm,
like, we're in lockdown. No, no one's going to see you. You're wearing a
mm.
mask. Let's pop the inman line on. So have you got your inman? I know you haven't got it on now, and that's great because we wouldn't really understand. Yes, there it is.
There it is.
There's the big
There's the
fella.
bad boy.
Yeah, I'm like little fella. You're like, yeah, nah, he's a bad boy.
Get that bad boy out. Yeah. So this is it. Just for people who are maybe going through the same thing. I did give
Yeah.
it a quick clean, so it hasn't just come straight out of my mouth. But the great thing about it is that if I'm having a coffee or something, I can pop it in and out, which
Yeah.
is it's a bit fiddly for the first couple of
Yeah.
weeks, but then
Yeah.
you kind of get used to doing it and you get used
Yeah.
to putting it in and out.
Yeah.
At time, I'll be honest, as you know, I did actually send Manrina a text one day saying, I hate to tell you, but I haven't got my brace in today. She was laughing, going,
I
again,
love you. Love
none of
you
my
telling me
patients
this.
tell me that.
Yeah. No, you're like, yeah. I wear it all the time. Can't you tell?
Exactly. So from that point, but I have to say it was definitely well worth me doing. I mean, I would, yeah, to anyone who's thinking about having a brace, Manrina changed my mind. Do it. It does work. It really
Yeah.
does work. It makes a big
Yeah.
difference. And the biggest thing I've noticed actually recently, sorry, is that my jaw comes together now. I know that sounds a bit weird, But because we had to do quite a lot of work up here,
Yeah.
I can actually bite again, which for
Yeah.
me is just absolutely phenomenal. You know, I've
Yeah.
not been able to do that for a long time.
Yeah.
So
And that's just going to get
that's
better
great.
through this whole
Yeah,
process. Yeah.
yeah,
So that's
exactly.
exciting. So you've got your brace now.
Yeah.
And then we're hoping to do, so I've done the wax up. So you've seen what your smile looks like, what it's going to look like at the end, because we've got the wax on. It was just amazing.
Yeah.
When I went,
Yeah.
when I designed it and then I saw it, I was like, ah, I sent you a video like, ah.
I
Yeah.
was
So
like, oh my God.
yeah.
It was,
Yeah.
yeah. And actually, that was quite, as you know, that was actually quite an emotional moment for me.
Yeah.
Because
Yeah.
seeing what my teeth were like compared to
Yeah.
what they were going to look like,
Yeah.
I remember looking at you going, wow, okay, that's a huge change for me. And I can't wait. Like, I literally am at that point where I just can't wait.
Can't wait. And
Literally
when I
can't
showed
wait
you
to
in
get them done.
surgery, I know you were like, I'm going to cry. I'm going to cry. And I was like, oh, I should be filming this.
Yeah.
Yeah. So,
Exactly,
yeah.
exactly. And I think that's something that I'm really pleased that I chose to do the brace and I didn't not listen to you, because at the
Yeah.
end of the day, you know what's right for me, and your
Yeah.
patient's interests are at, you know, at the
Yeah.
forefront, and you're looking after your patients. And from somebody who was absolutely terrified of dentists, from somebody who's had a lot of mistakes done, a lot of things that I've hated about it,
Yeah.
I now walk in and sit in the dentist chair
Yeah.
like,
Good.
ta-da, I'm ready,
Yes.
let's do it,
Yes.
you know.
Yes.
And I think that's the biggest thing for me, you know. It's
Yeah,
amazing.
that's always a big win when patients are, especially when they're nervous, and then when they start coming
Mm.
back and they actually start looking forward to visits, and you're like, oh, that that's when you know you've done okay, because they're, yeah,
Yeah,
there's good things
100%.
happening.
And that's, you know, for me, I get into the waiting room and I'm not sitting there with sweaty palms going, oh my God, I've got to go into the dentist. I'm actually
Yeah,
going in going, yep, I'm seeing Mandarina today. That's awesome, you know. And
yeah,
that's the way I see it. And that's how it should be, you know.
yeah,
There shouldn't be
yeah.
a fear there, basically.
No, there's no need to. Yeah,
Mm-mm.
exactly.
No.
So hopefully we will be able to do your smile makeover next month. We were planning on doing it on my Designing Smiles course, where I
Yes.
teach dentists how to do veneers, and it was going to be such a great case for that. But now, you know, with the government guidelines, we're allowed to do courses, practical courses in medical teaching. So it comes
Mm,
under the guidelines that we can, and actually it's small group
mm,
teaching. So I know that I can keep it very safe, and
mm.
you know, we'll COVID test you. We'll all be wearing masks. We can all social distance.
Yeah.
But I'm not sure. I'm starting to feel like I'm not sure it's the right thing to do, even though I know I can keep us safe. I just kind of still feel like, oh, but should we all just stay at home?
Mm,
So
mm.
we're going to reevaluate, aren't we, in a couple of weeks, and just see how the
Yeah.
numbers are going and see whether the course should run
Yeah.
in Feb. Otherwise, we'll just delay it by a month or two.
I think, you know
Um,
what, at the end of the day, to keep us safe, and to be honest, Mandarina,
yeah,
that's your call, you know.
yeah,
And
yeah.
as you know, I have 150% trust in you and what you
Yes,
do. You
yeah,
know, and that's really important. You know, you
yeah.
have
Thank
to have
you.
trust in you know, is looking after you and doing your teeth, because if you don't, then don't sit in that dentist chair. You
No,
know, for
yeah, it
me,
shouldn't be an
that's,
uncomfortable
you should never
process.
be
It has
an
to be a very
uncomfortable process.
comfortable
Yeah.
process. Yeah.
And also the other thing which I've really appreciated is that when I had like root canal done or a tooth out, which I've had to have done because of not looking after my teeth, which is not the best thing to do, is that you've always checked in, and that's a big thing, you know. And that's a really big thing. You've remembered that I've had that appointment and you've checked in, and for me, that's, you know, that's great. You know, that's what it's all about. It's a process, and I think that's something that, you know, as I said, going through the menopause and everything else, you start, you know, when you're not sort of, when you're going through change, it's when someone's actually supporting you going through that change. And that's the biggest thing. And I mean, all my friends are like, oh my God, we can't wait to see, you know, we can't wait to see this. And a lot
Yeah.
of people have literally been like, what are you having done? I'm like, I'm not telling you just now.
Yeah.
So tonight is actually quite a big thing for me coming out saying,
You're
yes,
telling
this is
people.
what I'm doing, you know,
Yeah.
this is
Yeah. We're
what
gonna do
I'm
a smile
doing.
makeover.
So
Yeah. Yeah.
yeah, yeah, it's a
It's
big
gonna. But
thing.
at the next one we do, your smile will be better than mine, and I'll be
I
like,
know.
no. It always
No,
happens.
there'll
I always
never
say,
be a chance of that.
my patients often say to me, like, oh, you know, I want a smile like yours, and I always say, your smile's gonna be better than mine. You just wait and see. Yeah. Give me a month or so. So yeah,
Yeah,
it's all
exactly.
really exciting, and it's all going, it's all happening. My thing keeps
Yeah,
flashing
it
because
is.
my
And it's like I said, it's having the, Oh, don't worry, don't worry. I think it's when you, you know, you can just, I think it's just been every step of the way, Manrina. You've taught me through the process. And
Yeah,
I think, you know, a lot of dentists you can go to are like, right, we're going to do this, we're going to do this. I mean, I'm
yeah,
not aligning it into being in a hairdresser's chair by any shape
yeah,
or form, but
yeah,
it's a big deal. And when you've had stuff that's gone wrong and badly wrong
yeah,
before,
yeah,
I mean, I could have been put off with the whole process when I had these abscesses and gone, do you know what, Manrina,
yeah,
no, you know, but I didn't. You and I talked it through. You were on the
yeah. We
phone
knew
checking
that
that
it's
I
your
was
wisdom
okay.
teeth, it's something separate. Yeah,
Yeah, and
yeah.
allayed my fears. And that's the biggest thing, is having
Thanks
my
for
fears
that.
allayed.
Comment. Nikki Staley said that, yeah, when you love what you do, then the results can be unbelievably transformational. And I think that's what's really important here.
Mm.
Hi Sav. So Sav was on our
Oh,
last
cool.
designing smile course. So yeah, with Nikki Staley, I think, yeah, it's really important to love your job. And I think we're both really passionate about what we do. And I think that's
Yes,
probably why we're friends,
yes,
and why, you know, we
yeah,
can see that in each other. And Sav, actually, yeah, he did our last designing smiles course, which you would have been the patient for if you hadn't got your wisdom tooth
teeth,
abscesses. So he
yeah.
got to do Daniel DeVoe, which was great as
Ah,
well.
yeah,
But
exactly, exactly. And I think that, you know, at the end of the day, I am Joe Bloggs off the street. You know, I'm nothing. I'm just, you know, a woman doing her thing and going through bits and pieces and stuff. But I guess for me, doing the work that I do, you tend not to think about yourself. You tend to
yeah,
think about others. And, you know, working on the buses and running buses for homeless as well with Dan is very much a case of you put other people first.
yeah,
And I kind of got to a point where I was like, okay, I'm beginning to get not drained because I love what I do, but I was
yeah,
like, if I don't take care of myself, I can't take care of other people.
yeah,
And that's the biggest thing, is about
yeah.
taking, you know, taking care of yourself, pulling
It's
down
giving you
your
lots
own
of
oxygen.
hearts.
Is literally putting the mask on. And oh, actually, sorry, Sky's just popped on. She's been amazing. Sky has been helping us on the community bus. Hi,
Oh wow.
Sky.
Ooh.
And she's been absolutely phenomenal. And I mean,
Yeah,
she's, you know, she's been helping us out. She was there very first day all the way through. She's been
yeah,
incredible. But you've got to put your own oxygen mask on. You have to,
yeah,
you know.
yeah,
So that's the biggest thing.
yeah, yeah. Okay, well, this has been wonderful, and I really
Thank
enjoyed chatting
you.
with
Me
you. I think we'll
too.
have to
Me
do this
too.
again
Yes.
at the other
Yeah,
end.
I'd love to.
Should we do
Yeah.
that? Yeah, when we've
Yeah.
got the fun makeover done, and then talk about how it all went for you, and then you can be really smiling away with your don't hide it.
Doing that whole nice pose.
Oh,
Yeah,
so,
no, would love to. Would love to do that.
yeah.
Perfect.
Okay, my darling. Well,
Perfect.
I'll let you get on with your Friday night. Thank you to everyone who joined
Thank
us tonight. It
you.
was really nice to
Thanks,
have a quick
everyone.
catch up, and I will see you all soon. And and your friend saying,
Oh,
yeah, thank you.
yeah, that's Nikki who's in New York. So she's tuning in from
Oh,
New York.
oh,
And
very cool.
she's in your industry as well. So
Oh,
she
she's
knows.
amazing. We had somebody from
Yeah,
India here too, so I love that there's all these people coming from around the world and
yeah.
tuning in and supporting. So
Bye,
yeah, that's
Sky. Bye,
amazing.
Sky.
Okay,
Okay,
my
thanks,
darling. I will
Manrina.
see you soon. Big kiss and have a
Mwah.
lovely
Take
evening.
care.
And we'll get you
Will
back on
do.
here after it's all done.
Cool. Bye, guys.